let's talk about the numbering system and the teeth that are in the human mouth. So, starting off, looking at your patient, that's how we're going to number this. We're going to start on the upper right. So this would be your patient's upper right. So we would start with the teeth with the third molar. So that would actually be number 1. So we're going to number these number 1 through 16. Then we're going to drop down on the lower left, and we're going to go 17 to 32. So there are an option of 32 adult teeth. Now, people get their wisdom teeth pulled. Some people are born with missing teeth. So this is kind of 28 is kind of the average of what number of teeth people have. And that's because those third molars get extracted usually whenever they're a teenager. So, but if they are erupted in this case, we're going to count accordingly. If when you go to chart, a tooth is missing, you're still going to count that space. That's how we're going to accurately chart what is going on for your patient. So, when you look at the human mouth, I already said there's 32 teeth. Now, there's a maxillary and upper arch, and then there's a mandibular arch, which is the lower. If you look at the patient's mouth, it's set up the same, just a mirror image. So, we actually have 2 arches, then we have 4 quadrants. Quad meaning 4, so 32 divided by 4 gives us 8. So you have 8 teeth in each arch. Now, the teeth are the same teeth as far as we have 3 molars, we have 2 premolars, we have a canine, we have a lateral incisor, then we have a central incisor. So, same thing. We have a central, lateral, canine, 2 premolars, then 3 molars. So, every quadrant has that. So, we're actually going to start with our wisdom tooth being our third molar, second molar, first molar. Then we have our second premolar, our first premolar, canine, lateral incisor, central incisor. Central incisor, lateral incisor, canine. Then we have our first premolar, second premolar, first molar, second, and third. So the third molar are our wisdom teeth. And that's what we're going to do for every quadrant. Now, numbering wise, we're going to start on the upper right. And like I said, we're going to go 1 to 16, drop down on the left, 17 to 32. So we're going to start on the upper right, and we're going to end on the lower right. So, number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. That completes our maxillary arch. Then we're going to drop down immediately on the left. Start on the mandibular left. 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32. So that is our numbering system with the arches and quadrants. Just a quick explanation of that. We have a couple other videos up as far as surfaces if you need help with that. But once again, we do appreciate your support. If you have an idea for a topic or video you'd like to see, please feel free to let us know. And that's something that we can work on. You can also find more content on our other social media platforms. We have availability on YouTube, Facebook, Instagram, and TikTok.